Welcome back to Houston Life. If you're struggling with daily joint pain or neuropathy, aside from traditional treatment options like surgery and medication, there are alternatives. The team at NexGenEsis Healthcare provides advanced therapies that they say can speed up healing and leave patients pain-free. Joining us now with a look at joint and nerve rejuvenation is Dr. Joe Furman and Dr. Abhishek Reddy with NexGenEsis Healthcare. Gentlemen, welcome to the show. All right, so a lot of people, we were chatting during the break. I have a friend who's dealt with neuropathy. People who live with just constant pain may think that surgery and medication are the only options, but Dr. Reddy, I'll start with you. How does NexGenEsis help people with their pain?
Yeah, so at NexGenEsis and North Houston Healthcare, we like to treat the patient as a whole. You know, the body has a natural ability to heal itself. We use a combination of advanced therapies as well as the patient's own biologics to kind of help speed up that healing process, okay? A lot of the times patients think that surgery may be the only option, and that's not necessarily the case.
We mentioned neuropathy, chronic pain. What types of things are you able to help fix?
So a lot of times the joint patients that we see are dealing with osteoarthritis, so normal wear and tear, breakdown of that joint space. This can cause bone-on-bone friction, leading to a lot of pain, decrease in functionality and mobility. You know, with our therapies and the biologics that we use to reintroduce into the joints, we can kind of help speed up that healing process and kind of give patients a better quality of life back.
And quality of life is so key, because for someone living in pain, just the daily activities, just moving around your house is sometimes really tough. Dr. Furman, talk about some of the patients you typically see.
Yeah, so typically our patients have tried lots of other options, things like steroid injections, which are harmful for joints, physical therapy, medications, and just haven't gotten those results that they've wanted, right? We see a lot of patients that are bone on bone, and they're, like Dr. Reddy mentioned, that surgery might be their only option, and we actually get some of our best results from these patients.
You're kidding. Okay, and when patients come to you, Dr. Furman, what are they complaining about? What are their symptoms?
So a lot of times with the joint pain, it's going to be more like aching pains, stiffness, dull pains that can develop into more of that sharp, shooting, debilitating pains, right? And as you mentioned, it's going to really affect their overall quality of life, not being able to do things that they want to do, like go walk in the neighborhood or in the park, go on family vacations. Even simple things like cooking or taking the stairs, you know, can become very difficult for them.
Excruciating, for sure. Things a lot of people take for granted become so difficult. Okay, what do you say we take a listen from a patient on how NexGenEsis helped them with their joint pain? Watch this.
It was a 10. I couldn't do anything, not even stairs. Yeah, and walking long distance was really bad. Even after the first time, I saw a difference. Even my daughter, when she saw me, she was skeptical at the first time I told her about it. But then when she saw me, she's like, Mom, I see a difference. You can walk. And I'm like, see, I told you.
And of course, joint pain is a huge issue for a lot of people. Dr. Reddy, let's talk again about neuropathy. What exactly is neuropathy and what causes it?
So neuropathy is usually damage to the actual nerves. It's when the nervous system isn't functioning at its optimal levels. You know, there's a lot of different causes for neuropathy, the main one being diabetes, leading to small vessel damage, and usually in the hands and the feet first, and the distal extremities. Some of the other causes include chemotherapy, radiation, even surgeries and injuries can lead to some neuropathy as well.
Which is just so unfortunate. It's like adding insult to injury. If someone's having another medical issue, they can then develop neuropathy. So how is neuropathy typically treated then?
So usually neuropathy is managed with medications. When I say managed, usually the symptoms are managed with medications. So that burning, that pain, that numbness, that tingling. These symptoms are kind of, it's more of a Band-Aid, the medication, like gabapentin, Lyrica are some of the common medications that are used. You know, they don't necessarily treat the underlying cause. But with NexGenEsis and some of the advances in the regenerative medicine techniques, you know, we can actually hopefully help to restore some of that function to the nerves.
Dr. Furman, Dr. Reddy just mentioned some of the symptoms of neuropathy. What are some of the other symptoms that you're seeing from patients struggling with this?
Right, so common symptoms are going to be numbness, tingling, burning, typically in the hands or feet. Balance issues are also very common. Swelling is also very common, and this is also going to keep people from being as mobile as they want, right? They're using canes and walkers and maybe eventually wheelchairs, right? Because unfortunately, neuropathy, it does tend to get worse. It progresses over time. So it can get to a point where the pain is really unbearable.
And so chat with us just about the process of NexGenEsis. How are you helping people heal themselves? This concept of regenerative medicine.
Right. So in using regenerative medicine, we are able to put the body in the best position to heal itself, right? We use lots of different treatments for neuropathy, just depending on the case. Things like different types of lasers, acoustic compression, nerve plates, even the patient's own biologics, something called PRP, or platelet-rich plasma, to not only stop the progression of the neuropathy, but even reverse it.
But to reverse it. Okay, what do you say we hear from another patient on how NexGenEsis helped them with their nerve pain?
I've been coming here since last December, a whole year. When I first come, my pain level from the neuropathy in my feet was at 10. Today it's at 0. They definitely helped. They did no kind of invasive procedures. I would recommend them to anybody that's having any problems. And I will add that my husband's been coming for knee, hip, and back pain. And he is so much better. I'm just tickled to death. If you're having problems with joints, with neuropathy or whatever, I definitely recommend NexGen first before you go get cut open.
Before you get cut open. And understandably, a lot of people do not love the idea of surgery. Final thoughts when it comes to your non-invasive treatment?
Yeah, so we do offer that alternative, right? People that have gone through all these different types of treatments, the injections, the physical therapy, the medications. If you're still looking for help, that's kind of where we step in and give that alternative to these treatments.
All right, Dr. Joe Furman, Dr. Abhishek Reddy, thank you so much for stopping by Houston Life.
Yeah,
good to see you both. In the meantime, NexGenEsis Healthcare does have a special offer for Houston Life viewers. The first 50 callers who call and mention Houston Life will receive a free phone consultation with a NexGenEsis provider. The phone number, 832-570-4529, or you can go online, nexgenesishealthcare.com. And we will be right back with more Houston Life. Don't go away.